1. A 23 years old client who is provider 3. Para 2 delivered a baby by vacuum, assisted vagina delivery 2 days ago. As part of the discharge teaching class for which conditions should a nurse instruct the client to call a physician? Select all that applies. A C. Pain that is not well controlled by prescription pain medication. B. In foul-smelling lochia. C. Pain in her calves when walking. D. Lochia serosa that is soaking less than a pad every 3 hours.
The correct answers are B. C. Foul-smelling lochia signifies infection, pain not controlled by pain medication. Needs her physician's attention, pain in the calves may indicate thrombosis.
The correct answer is A.
The correct answer is A. Glycosuria is most often secondary to the pregnancy-related increased glomerular filtration of glucose without an increased tubular reabsorption.
4. A client who is provider for Para 1 at 28 weeks gestation completes a 1-hour glucose tolerance test. Her 1-hour blood sugar is 150 mg DL. Which type of follow-up should a nurse recommend to this client? A. C. No follow-up. B. A 3-hour glucose tolerance test. C. A 2,000 calories diet. D. A 2-hour postprandial blood sugar.
The correct answer is B. Abnormal 1-hour test results should be followed up by a 3-hour glucose tolerance test.
5. A client who is at 32 weeks gestation comes to a clinic for a routine prenatal visit. She is having discomfort related to constipation. The nurse should teach the client that the most appropriate measures to alleviate this problem includes taking a mild laxative daily, B, and drinking hot coffee or tea each morning at breakfast, C, adding more protein and fat to the daily diet, drinking 8 to 10 cups of water, and take a daily walk. The correct answer is D. Pregnancy slows intestinal motility due to the influence of progesterone. Increased fluid and exercise stimulates intestinal motility.
6. A client who is at 25 weeks gestation presents for a routine appointment. The client asks the nurse why she is having trouble with constipation during her pregnancy. Which explanation by the nurse would be most accurate?
C. The intestines are expanding during pregnancy, which causes stool stasis. B. And the muscle movement of the intestines slows down, which causes dry hard stools. C. The intestines are compressed during pregnancy, which causes stool stasis. D. The muscle movement of the intestine speeds up, which causes dry hard stools.
The correct answer is B. During pregnancy, progesterone causes peristalsis movement to slow down so that more nutrients can be absorbed. 7. A client who is gravida 6 para 2 is admitted to labor and delivery in early labor on October 18th. A nurse palpates regular uterine contractions every 5 minutes with moderate intensity. A. Sterile vaginal examination reveals a soft cervix that's 2 centimeters dilated, 85% effaced and a minus gestation. Which admission information is most important in planning this client's nursing care? The client's last menstrual period was January 2nd. B. The client's blood type is RH. C. The client's hemoglobin is 11 gms. DLD. Her blood pressure is 1/64 of a millimeter Hg. The correct answer is A. According to Naegele's rule, this is a post-date pregnancy. 8. A pregnant client attends a first trimester class on eating well for pregnancy. Which statement should indicate to a nurse that the client requires additional teaching? Am I strange craving to eat laundry? Starch is a normal part of pregnancy. B. I should gain around 30 pounds by my due date. C. I need about an extra 300 calories per day during my pregnancy. D. Frozen foods are more nutritious than canned foods. The correct answer is strange cravings called pica are not a normal part of pregnancy and may be associated with iron deficiency. 9. A client who is 22 years old, gravida 1, paro 0, is admitted to an obstetrics unit with contractions every 8 to 10 minutes. A physical assessment reveals that her cervix is 3 centimeters dilated, 100% effaced and a 0 station. A nurse asks the couple about their plan of pain relief during labor. The couple plans to use prepared childbirth techniques. Which pain relief method should the nurse expect the couple to use during this phase of labor? A. Slow deep breathing. B. Narcotic analgesia. C. General anesthesia. D. Rapid, shallow breathing. The correct answer is A. 10. A client who is 37 years old, gravida. For paro 3 at 14 weeks gestation asks A. Nurse, do you think I'm having a boy? All my other children are girls. If I don't have a boy this time, my husband will really be disappointed in me. Which explanation by the nurse would be most accurate? A. The heartbeat of the baby is fast. That means it's a boy. B. Girls probably run in your family. There's nothing you can do about it. C. The father's sperm determines if the baby is male or female. D. Don't worry, you are carrying this baby low. That means it's a boy. The correct answer is C. Only the father's sperm cell contains the Y chromosome, which is male. 12. A client 12 weeks gestation at her first prenatal visit is given instructions to get prenatal labs and a multiple marker screen drawer at the laboratory. She asks a nurse about the purpose of the multiple marker screen. The nurse should inform the client that the conditions that may be detected with this test are: select all that applies. A. Gestational diabetes. B. Trisomy 21. C. Pregnancy-induced hypertension. D. Edwards syndrome. The correct answer is B. D. 13. A 24-hour-old neonate is icteric with a serum bilirubin level of 14 milligrams, 100 milliliters. The mother's blood type is O+. The blood type of the baby is B and has a positive direct Coons test. The infant is being breastfed. Which measure should a nurse include in the neonate's plan of care? A. No special measures are necessary. Newborns normally get a little jaundice. B. Tell the mother to stop breastfeeding and give formula to the baby instead. C. Place the infant under the bilirlights and prepare for an exchange transfusion. D. Encourage the mother to increase the frequency of breastfeeding sessions. The correct answer is D. Early and frequent breastfeeding tends to lower serum bilirubin levels and avoids dehydration that increases the serum bilirubin levels. 14. A client who is gravida to paro 0 has a routine ultrasound at 18 weeks gestation to confirm her estimated date of delivery. The ultrasound shows the fetus in a breech position. The client asks a nurse, "Does this mean I will have to have a C-section?" Which response by the nurse would be most accurate? A. The baby will have more room to turn as your delivery date nears. B. If a baby is breech at this gestation, it must always be delivered by caesarean sections. C. You can probably deliver normally. Most babies are born breech. D. Many babies are breech at this gestation. Most turn to head down by term. The correct answer is D. 15. A labouring leant who is gravida 1 paro. 0 has had no change in her cervix for 2 hours and remains 9 to 10 centimeters dilated. The fetal head has remained at 0 station. A vaginal examination reveals a position of occiput posterity. Which action by the nurse would be most appropriate? A. Prepare the client for a forceps rotation. B. Assist the client to a supine position. C. Assist the client to a hands and knees position. D. Prepare her for caesarean delivery. The correct answer is C. Maternal position changes such as sitting, kneeling, lateral, or hands and knees can assist fetal head rotation from an occipito posterior to occipito anterior. 16. A client with preterm contractions at 34 weeks gestation is dilated to 3 centimeters. A physician orders an amniocentesis. For fetal lung maturity, which laboratory test will provide the most information to a nurse about fetal lung maturity? A human chorionic gonadotropin HCG. B. Phosphatidylcholine. C. Partial thromboplastin time PTT. The correct answer is B. Phosphatidylcholine is a major phospholipid of surfactant. The presence of it in amniotic fluid indicates lung maturity. 17. A client who is gravida 6 paro has a routine ultrasound at 16 weeks gestation. The ultrasound shows that the client is carrying dizygotic twins. Which explanation by the nurse would be most accurate? A. Monozygotic twins come from 1 egg and 2 sperms. B. Monozygotic twins come from 2 different eggs and sperm. C. Dizygotic twins come from 2 different eggs and sperm. D. Dizygotic twins come from 1 fertilized egg that splits. (18) A client who is 18 years old presents to a prenatal clinic because her menstrual period is 9 days late. She tells a nurse, "I'm sure I'm pregnant because my period is late and my breasts are tender." Which response by the nurse would be most appropriate? A. Missed menstrual period and breast tenderness are probable signs of pregnancy. B. A missed menstrual period and breast tenderness are presumptive signs of pregnancy. C. A missed menstrual period and breast tenderness are positive signs of pregnancy. D. A missed menstrual period and breast tenderness are negative signs of pregnancy. (19) A client who is gravida to para 1 is seen in an emergency department at 14 weeks gestation with a bright red vaginal bleeding and severe lower abdominal cramping. Which assessment finding is the most important observation at this time? Increased pulse pressure. B. Increased temperature. C. Increased heart rate. D. Increased blood pressure. The correct answer is C. Increased heart rate in the presence of. Visible bleeding indicates excessive blood loss. 20. An anaesthetist has just placed an epidural catheter dosed with bupivacaine hydrochloride in a client in labor who is gravida to para 1 at 39 weeks gestation, for which side effects should a nurse observe this client? A. Hypotension, B. Hyperventilation, C. Hypertension, D. Hyperventilation. The correct answer is A. With epidural anesthesia, those sympathetic nerves are also blocked by the medication, resulting in vasodilation and hypotension. 21. A nurse assessed a client who is 40 years old, gravida 11 para 9 at 14 weeks gestation, and has a history of thromboembolic disease. The client is placed on daily heparin therapy. Which laboratory test will be the most important for this client? A. Bleeding time, B. Partial thromboplastin time, C. Prothrombin time, D. D-dimer. (22) A client who is 36 years old has been trying to get pregnant for about 5 months at her physician's appointment. She states that she knows she should take folic acid supplements but dislikes taking pills. Which foods that are high in folic acid should a nurse suggest? Select all that applies. A. Salmon, B. Spinach, C. Orange juice, D. Asparagus.